Thanks for attending our La Plata Democrats Club lunch. The goal of the club is to bring together all Democrats from the most conservative to the most progressive to celebrate our shared values, appreciate who we are, and to work together to put more Democrats in office. I would like to acknowledge our club lunch sponsor, Albrechta and Albrechta Law Firm. They've been supporting us for several years now. So if you need legal help, please think about Albrechta and Albrechta. I'll put their website in the chat. Our speaker today is Guinn Unger, the president of Colorado Healthcare Coalition, which is a La Plata County-based 501c3 nonprofit. His presentation is Our Broken Healthcare System and How We Can Fix It. He'll describe why our healthcare system costs twice as much per person as healthcare systems in other developed countries, while still not covering everyone and while providing some of the worst healthcare outcomes among those developed countries. He'll outline efforts which are currently underway to create a state-based universal healthcare system in Colorado. So the procedure is everyone's asked to stay muted except for the speakers and myself. Guinn Unger will help with questions actually I'll help with questions. He usually does that. So I'll be doing the questions today. If you want to submit a question different from the ones that are asked during the lunch, please use the chat feature on Zoom. Please do not unmute yourself and speak. Send your questions to everyone in the chat window. And if you're having trouble with internet connectivity, you may want to disable your video. Audio only works better on slower connections. This Zoom meeting is being recorded and will be available within a day or so for viewing on our YouTube channel. I'll put the link in there in a few minutes too. It's just put La Plata Democrats in the YouTube search bar and you should find them. You can choose speaker mode, which is typically in the upper right corner, which will bring up a larger video of the person speaking. And I would like to encourage everyone to donate to the La Plata County Dems in this important election year. It keeps our office rented and we can accumulate funds ahead of need. Monthly donations are particularly appreciated and you can set those up on ActBlue. Monthly donations make it easy for you to give to the party with relatively little pain. This is our fourth club lunch for 2024. We're working to bring great programs for you in the future. If you have any announcement to make, you can put them in the chat as we go, and we'll recognize it at the end of the luncheon. So introducing Guinn Unger, he is passionate about educating everyone about universal health care. He has been providing webinars and in-person presentations to small and large groups for almost a decade in La Plata County. There is finally some movement towards the state of Colorado creating a universal single-payer healthcare system for all its residents. Welcome, Guinn.
Thank you, Karen. Glad to be here again. I'm in a little different role here in that I'm doing the presentation rather than being an officer of the La Plata Dems. I hope you'll find this interesting. Give me just a moment here to share my screen and we will get going. Get rid of those Zoom windows here.
So I see your I see your screenshot rather than, okay, that looks good.
Yeah, I just had to get this going. This is my contact information. I would be, of course, more than happy to talk to anyone about this subject. And that's my phone number. I don't, again, have any problem with anybody calling. If you're interested in the Colorado Healthcare Coalition, there is the URL for our website. The name of this is Our Broken Healthcare System and What We Can Do About It. So I'm going to try to convince you, and it may not take much convincing, that our healthcare system truly is broken. And then we will talk some about what we might be able to do about that. I saw this the other day on Quora. It says, if you want to understand any problem in America, you need to focus on who profits from that problem, not who suffers from the problem. And you're going to see in this presentation that that's what we are focusing on, is who's making the big profits that are causing a lot of the problems here. So I would ask, if I were doing this live, I'd ask people to raise their hands and don't need to do that here. How many of you would consider yourselves to be financially responsible? And I suspect, pretty much everybody would raise their hand and say, yeah, I consider myself to be financially responsible. So if you consider yourself to be financially responsible, shouldn't you be outraged at the fact that we waste $2 trillion, that's $2,000 billion each year, by spending twice as much per person for healthcare as other developed countries? And we don't get better healthcare. So the other thing that I would say is, don't just accept what I say here. Obviously, I think virtually everything I'm going to say is fact, but you can look it up. It's pretty easy to find all of this information, and my job really is just kind of pull it into a workable presentation. Problems with our current healthcare system. Well, the first is it is incredibly expensive. We're spending $4 trillion every year. And again, if we're spending twice as much as we would need to provide the same quality of healthcare, then we're wasting $2 trillion. In 2021, there were roughly 30 million people who still didn't have health insurance. 43% of working age adults were inadequately insured in 2022. Now, what does that mean? It means that they have insurance, but they can't afford to use it. And that's generally because of high deductibles and copays, where the patient has to pay a certain amount before the insurance kicks in. And, that can in many cases be thousands of dollars. There were roughly 250,000 personal bankruptcies caused primarily by medical debt in 2022. So that's 250,000 people or families that lost everything they have because they got sick or injured. We pay anywhere from 2 times to 10 times as much for pharmaceuticals as other countries. Cancer treatment costs can result in significant debt that lasts long after treatment has ended, even for those with insurance. So the statistic is that about 50% of people who get cancer will spend every penny they have, even those people who have insurance. Medical inflation is another problem. In general, prices for medical care in the U.S. have risen significantly faster than the overall inflation level. And that means that the cost of medical care is going up in real terms. It's not just at the same rate as inflation, but it's going up substantially faster than that. And you can imagine over a period of time, even if it's only 2% higher than the inflation level, you start compounding that 2% over decades, and all of a sudden you're spending a lot more for the same thing than you did before. And so, that just means that the real cost continues to increase, and that ultimately leads to these extremely high levels of healthcare expenditures that we're seeing now. Prior authorizations, I want to play for you a short video here. If this starts up and you can't hear it or can't see it, let me know. I think it's going to be all right.
Imagine you wake up with blurry vision. Your doctor refers you to a specialist, but your insurance blocks the referral.
Call me to defend why you think this patient needs this.
That causes you to go blind. Imagine you have multiple sclerosis. Without warning, your insurance stops your medications.
No, you cannot give this drug.
So you become paralyzed. Imagine your father has cancer. His doctor orders an MRI.
No, you cannot order this imaging.
Prescribes chemotherapy.
Have you considered this other, less expensive option?
His insurance causes delay after delay.
No, you don't need this surgery.
He dies. An absurd process has infiltrated American healthcare. It's called prior authorization. Here's how it works. Before your doctor provides a treatment, your insurance requires them to prove it's necessary. This is often a time-consuming process that can cause dangerous delays.
I'm sorry, your cancer could be cured, but we need to wait for the insurance company to approve your chemotherapy.
That's Dr. Jane. She's barricaded by prior authorizations daily.
This is a really big issue, and it impacts every single person in this country who has insurance.
Prior authorization was actually created to save you money. Decades ago, it was used sparingly, only to make sure expensive treatments, like long hospital stays, were absolutely necessary. But now,
It's devolved into now a system where a lot of times things are really denied for no reason.
even everyday medications now require insurance approval.
Could be for medications to treat heartburn.
ADHD medication.
Test strips for patients to be able to check their blood sugar.
Chemotherapy.
Prozac.
When I prescribe a medication, I would say 95% of the time I have to obtain a prior authorization.
New York Times Opinion interviewed more than 50 doctors and patients. Their experiences suggest that insurance companies often weaponize this mundane process in order to control doctors and inflate their profits.
If they deny care or they delay care, that's money the insurance company gets to keep.
The way that they profit is to deny care.
As prior authorization has spread, delays in care have become normalized. So have tragedies. 1 in 3 doctors say that it's caused a serious medical issue or even the death of one of their patients. Ocean went blind.
It was like the insurance company telling me that my life didn't matter.
Michael couldn't walk or stand for 4 months.
It's like, I am scared of MS, but my fear as of right now is more of the insurance company.
And Vivian lost her father.
I spent so much time on the phone, writing letters, faxing, that I didn't get to spend that time with my father.
This is medical injustice disguised as paperwork. When your prior authorization is denied, you have 3 options. You could just pay out of pocket, but healthcare is so ridiculously expensive that that's not realistic. You can give up. That's what happens up to 80% of the time. A win for your insurance company. Or your doctor can go to bat for you.
When our prior authorizations get denied, we have to do what's called a peer-to-peer.
A peer-to-peer is supposed to be a phone call where you call somebody who is your peer to justify the treatment that you want to deliver.
I'm a pediatrician, and sometimes I'll end up talking to a neurologist.
People who couldn't pronounce the names of the drugs I was trying to prescribe.
Oftentimes, it's not even a physician.
Now imagine you have to do that 5 to 10 times a day.
What's even more ridiculous about this whole process is that after we go through all of this, if you're really a determined provider, you'll probably get your drug or your procedure authorized.
Insurance companies say that this process helps reduce the cost of expensive treatments, ensure safety, and lower the total cost of care. But what it's actually doing is creating a lot of expensive bureaucracy.
We have 4 full-time employees who their sole focus is on obtaining prior authorization for medications to treat Crohn's disease and ulcerative colitis. And that's just for one disease state.
By one estimate, the US spends about $35 billion a year on the administrative costs of prior authorization.
These resources could be devoted to patient care, answering phones in a timely fashion. I might actually get to go home and see my family on a regular basis.
In an admission of sorts, some companies have actually pledged to reduce prior authorizations, but those efforts only scratch the surface.
I am a board-certified gastroenterologist. I know what I'm doing, only to be blockaded by all of this bureaucracy, red tape, which really only serves to enrich the insurance companies.
Cigna made $5.2 billion in profit last year. Elevance made $6 billion. United Healthcare made $22 billion.
I had a patient who had a new diagnosis of lymphoma, and the insurance company was giving us a hard time to give the chemotherapy. I got someone on the phone, and I told the person, I said, I need your name, because when this young man dies, I want to tell his parents who was the reason behind it. I went home and I cried after I hung up the phone because I was so emotionally exhausted. And that was just one patient. I had seen 25 other patients that day, and many of them would eventually need prior authorizations as well.
Prior authorization gives your insurance company more power than your doctor. Now, there are some complicated cases when it makes sense to double-check that your doctor isn't unnecessarily overprescribing. Imagine you've had a cancerous tumor removed. To be extra safe, your doctor recommends an additional treatment, but it costs $170,000.
On the one hand, I can see where insurance companies are coming from with, wanting to take a careful look at these expensive treatments. Then on the other hand, I'm a human and I'm a young mom. What's my life worth?
Sarah's insurance denied the treatment. The question is, do you think they made that decision based on what was in her best interest or theirs? In many countries, these tough ethical decisions about what is covered are made by governments, not for-profit insurance companies. The government should abolish prior authorization, or at the very least, reform it.
My goal with Senate Bill 247 is to reform the prior authorization process.
House Bill 3459 creates a streamlined prior authorization process known as, quote, gold carding.
A handful of states have created gold card programs. Doctors who have successfully obtained prior authorizations in the past are exempt from needing to obtain them again. All states, and the federal government, should pass laws like these. Your insurance should not be a barrier between you and the healthcare you need.
I finally got the authorization to see the neuro-ophthalmologist after 12 weeks, and he said, "We're gonna do this surgery, but it's only to preserve the vision you have left. If we had seen you earlier, that would have been a different story. Maybe I'd be able to see now. Maybe I'd have a different life."
So this is fairly typical of the kinds of things that are going on. And we'll talk about some more things here as we go through the presentation. Coverage denials. Another way that they increase profits is by simply denying coverage. So they will say something like, this treatment that you want is not medically necessary. And there's stories about this that have come up in the press. Health insurance companies have set up systems that make it incredibly efficient for them to deny coverage. So one of the things that's required in order for an insurance company to deny coverage is that decision has to be made by a doctor. However, that doctor does not have to look at the charts for that patient or consider what it is. They just need to say this is going to be denied. So there was a story about United Healthcare and some of the other larger ones that have these systems set up to where the computer goes through and decides what it doesn't want to cover. And then it provides a screen for the doctor, and the doctor just goes click, deny, click, deny, click, deny, click, deny. So they can deny a very large number of claims, which obviously is not what was intended when it was originally required that a doctor sign off on a treatment that's denial. I'm not going to, this is a ProPublica article about United Health's effort to deny coverage for a particular patient. And I'm not going to go through the whole thing, but this was a person who was a student at Penn State University. So United Healthcare has the insurance for Penn State. And this particular person, they suffered from what they call a crippling case of ulcerative colitis, which caused him to develop severe arthritis, debilitating diarrhea, numbing fatigue, and life-threatening blood clots. And his medical bills were running nearly $2 million a year. His parents were both professors at Penn State, and they went to Penn State to see if they could do anything about this when United decided they didn't want to cover this anymore. And United had flagged McNaughton's case as a high dollar account. Company was reviewing whether it needed to keep paying for the drugs. And the parents and the son had spent literally years trying to find somebody that could do something for him. And they went to this person at the Mayo Clinic who's supposed to be the world expert on this. And what he was able to come up with something that actually brought the level of the problems from the disease way down. And what it was is he was giving the same drugs that they normally give to people with ulcerative colitis, but in much higher dosages, because they weren't working for this kid at the lower dosages. So you can imagine these are expensive drugs, and the doctor's prescribing large quantities of them for this particular patient. And so United decided, no, we're not going to cover that. And they said it's not medically necessary, which, again, in this guy's case, it was medically necessary. And the last I heard, the McNaughtons sued United Healthcare, and United Healthcare had agreed to continue paying for the drugs and the treatment through the end of that year, but not beyond. And the fact that they literally had to go to court to get United Healthcare to do what they're supposed to do under the contract, the insurance contract, is just another example of the kinds of things that are going on. And there was also, when you sue somebody, you get the ability to ask for all the information they have about this particular thing. And so they had these text messages between different United employees who had said, well, we're not going to cover this, it's too expensive. And one of them said, well, they'll file an appeal, but it's going to come right back to us and we'll just deny it. So even though United was trying to play the part of, we're just trying to make sure we're not spending too much money, it was clear that they have, built into United Healthcare these departments that look for cases that are costing them a lot of money that they can try to deny coverage. So you could make the case that we're spending all this money and it might be worthwhile if, in fact, we were getting better healthcare than people in other developed countries. But the fact is that we're not. Now, the Commonwealth Fund does a survey every couple of years. And the last one, I guess, was 2021 at this point. And they evaluate healthcare outcomes for 11 developed countries. And as you can see here, the United States ranks last overall, despite spending far more of its gross domestic product on healthcare. And they've unfortunately, we finished last for the last couple of decades. This is not a new thing. So, since we're comparing to other developed countries, you can say, well, we might be last, but we might still be pretty good. But you certainly can't say that we get better healthcare than people in these other developed countries. So this is just something that shows you the performance rankings, and you can see we're over here on the right, and we overall ranking is 11. Care process, which I'm not even sure what it is, we rank number 2. But if you look at the bottom line, healthcare outcomes, we're still number 11. So you can't make the case that we get better healthcare because we're spending all this extra money. Also, if you just look at healthcare spending as a percentage of gross domestic product, way over on the left here, we have 1980. And while we were, at the top, we weren't all that much higher than the other developed countries that are shown here. And yet, by the time you get to 2019, we're way, way higher as a percentage of GDP. And of course, our GDP per person is higher than these other countries. So, that it doesn't look like we're spending twice as much per person. But if you did the calculation, yeah, sure enough, we are. So why are we doing this? Well, the real key to this is our healthcare system is designed to make billions of dollars in profits for large companies. And it's not designed to provide healthcare to all that need it. And this is, again, much different than other countries. We are the only developed country in the world that doesn't make sure everybody can get the healthcare that they need. Is this what we want? Well, I guess it depends on who you are. For most of us, that's probably not what we want in a healthcare system. Some healthcare executives make tens of millions of dollars each year, and some large corporations make billions of dollars in profit each year. So I ran into some information about the CEO of a pharmaceutical company, and he was making over $100,000, not $100,000 a year. He was making over $100,000 a day, 365 days out of each year. So you can imagine that when people are making those kinds of salaries, or the companies are making those kinds of profits, they are absolutely opposed to making drastic changes in the healthcare system, and they're willing to spend hundreds of millions of dollars lobbying to keep the current system. We've seen this back in 2016 when we had Amendment 69 on the ballot. The special interest spent far more money on trying to defeat that referendum than we had in order to push it forward. So another interesting thing that I ran into is, why do we need health insurance? So we're conditioned to think that we need health insurance. If you think back to the ACA, Obamacare, you know, that got health insurance for more people. So, you know, we've just been conditioned to associate health insurance with health care. Dr. Joe Jarvis, who's a conservative, and he's definitely conservative, physician, author, and documentary producer, says in this book that health insurance is the most wasteful method ever invented to fund healthcare. The most wasteful method ever invented. So we kind of need to, in my opinion, stop thinking about health insurance and start thinking about health care. Obamacare, the Affordable Care Act, if you remember what was going on there, universal health coverage was not even considered when Obamacare was being debated. Obama said we were not going to try to achieve universal health coverage. More health insurance was issued and more people qualified for Medicaid, but of course this increased business was paid for by the taxpayers. Prices continue to rise, and there's absolutely nothing affordable about our healthcare system. So how do other countries pay for healthcare? Well, some of them have government-run healthcare systems like Great Britain. That means that the government employs all the doctors and nurses and people in the system. They make all the decisions about the healthcare system. They own the hospitals and so on. This is, I mean, you could definitely call that socialized medicine because it is run by the government. On the other hand, if you recall the 2012 London Olympics opening ceremony, they had a tribute to the national health system. So people in Great Britain are generally very satisfied with that system. But that's one way that other countries pay for healthcare. Another is a single payer healthcare system, which Canada does. And then there's some highly regulated public-private insurance kinds of things that countries like Germany do. So you might ask yourself, we hear a lot about single payer. Is that the only option if we want universal health care in the US? And the answer to that is no, that's not the only option. It probably makes the most sense. If you think about the US government buying all of the hospitals and clinics and hiring all the doctors and so on, that's just not really realistic. So the idea of trying to do what Great Britain does doesn't make any sense. And of course, if we try to do the public-private insurance thing, that just drives the price up, and it still leaves a lot of administrative expenses involved in the system. So again, I think single payer probably makes the most sense. You could argue, you know, for a different system, but let's talk for a second about what a single payer healthcare system is. In a single payer system, a government agency takes over all payment functions. So they're collecting premiums or taxes and so on, but the healthcare continues to be delivered by the same mostly private entities that are delivering it now. So if you're going to a doctor who's has his own practice, or he's part of hospital practice, whatever it is, that same doctor is going to continue to deliver those services. The government will just simply take over paying for it. So in this kind of system, doctors and patients make healthcare decisions, not insurance companies, because there are no more insurance companies. And so, you know, there's a documentary where this doctor in Canada is asked, well, what do you think about deductibles and co-payments? And she says, what are deductibles and co-payments? So the system up there, again, the doctors make the decisions on what needs to happen. The government agency collects the funds and pays for the healthcare. And so you hear this called, at least recently, publicly financed, which means we, the people, through the government, are financing healthcare, but privately delivered. So who would be opposed to a single payer universal healthcare system? The answer is obviously the people and companies making massive profits off the current system. And so the most prominent, what I call special interests, would be the health insurance companies who don't want to see things change. If we went to single payer, they wouldn't have any business. The pharmaceutical companies who are charging us these outrageous prices compared to what other countries pay because we don't allow Medicare to negotiate with pharmaceutical companies. There's a little bit of progress being made on that. And large hospital chains. The biggest part of the money that we spend actually goes to hospitals. So let's kind of talk about what the special interests will say about single payer if something, say, goes to the voters to try to establish a single payer system. So the first thing that they'll say is single payer will cost too much. And at first that sounds like that might be logical. After all, you're going to have more people covered for more things, so surely the cost is going to go up. But in actuality, there are no studies that I'm aware of, and I think I'm aware of just about everything, that show that single payer would cost more than we spend now. So the savings will offset spending for more people. So the estimate is that providers, doctors, hospitals, whoever is providing care, have to spend hundreds of billions of dollars each year just to be able to deal with the administrative burden of trying to deal with insurance. So it's pretty clear that we would actually save money even the very first year. When the Colorado legislature commissioned a study from the Colorado School of Public Health a couple of years ago, they estimated that we would save between $1 and $4 billion the very first year, depending on how much the reimbursement rates were. Even at 250% of Medicare, these taxpayers of Colorado would save $1 billion. So another one you'll hear for absolute certain is you don't want socialized medicine, do you? And of course, the good thing about this, though, is single payer is not socialized medicine. We just talked about that. Great Britain has socialized medicine, but in a single payer system, the government agency pays and the doctors and patients make healthcare decisions. This is a good one. Private markets are always more efficient than the government. You'll definitely hear that. And I would say, well, maybe when it comes to making a profit, this is mostly true, but private health insurance companies spend 18 to 20% of every dollar on administration and profit, which means that they're actually paying out only about 80% of every dollar that they take in on actually paying for medical care. Medicare, on the other hand, spends only 2 to 3% on administration and nothing on profit. So which one is more efficient at actually delivering health care? And when you look at it and you think about all the things a private health insurance company has to do, each year they got to decide what states are we going to sell in, which counties in the states are we going to sell in, how much are we going to charge, who are we going to have in our network. So there's an incredible amount of administrative burden on the healthcare companies, which makes them very inefficient. And when you talk about private markets, to have a properly functioning private market, you need at least the following. You need price transparency. I probably don't need to talk about that very much. There's been some efforts to make prices more transparent, particularly with hospitals. But I mean, I had a fairly minor operation a few years ago, and I got a bill that had like 32 different things they were charging me for. And I would say half of them, I didn't even know what they were. So the idea that you can figure out what something's going to cost at different places, I think, is totally flawed. You need real competition. That's we don't have real competition. Obviously, in places like La Plata County, we've got a little bit of competition between, say, Mercy Hospital and Animas Surgical Hospital. But there's a whole lot of things that Mercy does that they don't do over at Ash. And so there's not really a lot of competition there. The other thing is, if you think about what happened to insulin prices, insulin is made the same way it's always been made. It was discovered 100 years ago. And yet the price of insulin started going up. There were 3 companies that basically produced insulin for the US market. And all 3 of them started raising their prices. And it's been known for quite some time by big companies in particular, but medium and small companies, that the best way to increase your profits is by increasing your prices. Now, the downside to that in a private market is that should cost you some market share. But if all 3 of those insulin companies know that the best thing to do is to raise prices, they can all raise them together as long as they don't collude and they don't talk to one another and say, I'll raise my price if you'll raise your price. But if they just know that they all know that the best thing to do is drive the price up, then that's what happened. And so insulin prices went way up for no competitive reason, but simply because there wasn't any competition. And of course, knowledgeable consumers, again, when you're buying a car or a big screen TV or house or whatever, it's hard enough to be knowledgeable in those kind of situations. But certainly for medical care, I mean, unless you're a doctor or a nurse practitioner or something, you know, there's no way that you can know where to go to shop and how to get the best deal. So, you know, our current system has none of these. Another thing you may hear is we can't say for certain that single payer would work in the US. And what I would say is our closest neighbor, Canada, has had single payer for over 60 years. It works well. Canadians strongly support it. We're not that different than Canada, and there's really no reason at all to suggest that a single payer system would not work here. There's not enough public support for a US single payer system. I'd say that could be because of all the lobbying done by the special interests. But in any case, we know that the chances of establishing universal healthcare at the federal level are quite low at the current time. And that's why we're looking at a single payer system for the state of Colorado. Another thing you'll probably hear is a single state, single payer system would not be efficient. And I would agree that a single state system wouldn't be as efficient as a federal system. But again, this study that the Colorado School of Public Health did that was released in 2021 showed that we would in fact save billions of dollars, and we could do that while covering every resident of Colorado. This is a strange one. They say all the doctors will quit because they won't get paid enough. And my answer to that would be pretty stupid to create a system to provide healthcare to all Coloradans and then pay the doctors so little that they quit. So again, you know, we get back to that. Even if we pay doctors 250% of Medicare rates, we still save $1 billion. And of course, the administrative costs will be much lower for providers. So while the doctors might not get quite as much top line income, they also would not have nearly as much in the way of administrative costs that affect the bottom line. People come from Canada for medical treatment. You hear that? The data shows that about 32,000 Canadians come to the US for medical treatment out of a population of 32 million. And that's 1/10 of 1% of the population. But if you think about it, who are those people? Those are the people who can afford to pay cash for their treatment. So neither the Canadian government nor the US government is going to pay for that. So it's going to be out of pocket for Canadians who are coming to the US for medical treatment. So it's a small percentage of the population. Some of them may feel that they can get a little better healthcare if they go to Mayo Clinic or MD Anderson or Johns Hopkins, but it's a very small percentage of Canadians who are doing that. There are waiting lines for services in Canada due to their single payer system. This is another claim that the special interests will make. But I would say, you know what? There's also waiting lines in Great Britain, but they don't have single payer. And there are waiting lines in France, but they don't have single payer. And guess what? We have waiting lines in the US, but we don't have single payer. So, you know, waiting lines are caused by a shortage of doctors and other healthcare professionals, not by a single payer system. So I had a friend that I worked with at NASA years ago who went to England to do a project and met an English guy, and they got married and had children, all that kind of stuff. So some years back, she was diagnosed with lung cancer. And she said she was in for treatment the next day. So when these places that, you know, have to have waiting lines run into that, they prioritize. They say, okay, who needs treatment first? And in this case, since lung cancer is a very serious disease, my friend got to go to the front of the line to get treatment. So it's set up so that if you need something more than somebody else, then you get it first. And of course, we could fix that by just having more doctors, which for years the American Medical Association has opposed, although they're making a little bit of progress now. So why would we want a single state system? So again, you know, those of us at the Colorado Healthcare Coalition would much prefer a federal single payer system but we can benefit greatly from a Colorado system. And we would expect that after a few states show that this does work, the pressure for a federal system become irresistible. And this is how it worked in Canada, by the way. It started out in Saskatchewan. The prime minister there thought this would be good for business and good for people, because businesses, when somebody got hurt, if they couldn't get medical care, they were out longer, they had to be replaced. So then once the rest of the provinces in Canada saw how this was working, they adopted it. And eventually there was a kind of a federal umbrella that was put over all of that. So what's the next step? There's a bill, HB 24-1075, that has been introduced into the 2024 Colorado legislature. It has passed the Health and Human Services Committee, and it, if passed, will commission a detailed analysis of the feasibility of creating a publicly financed, privately delivered universal healthcare system in Colorado, including how to finance this system and the impact to the workforce. So this analysis is designed to provide the information that would be needed to craft a single payer system that would work well in Colorado. So we would ask you to contact your representative and senator to support this bill. The bill is unfortunately stuck in the Appropriations Committee in the House. And the problem is that there's not a lot of money available for the things that aren't absolutely required in terms of the budget. So there's some concern among the Appropriations Committee, even though the people on the Appropriations Committee generally support this bill pretty strongly. It's about a $400,000 price tag. So the other thing you might consider doing is contacting the members of the Appropriations Committee and ask them to move this along. So once it comes out of the Appropriations Committee, it'll have to be passed by the full House, which we feel will go pretty good. Then it'll go to the Senate. It'll go to the Health and Human Services Committee in the Senate, where again, we think it'll pass. Then it'll have to go to the Senate Appropriations Committee. We're told that's not generally a big deal once it's passed appropriations in the other chamber. And then, of course, the Senate would have to vote on it. And you may be familiar, last year, we ran a bill to do essentially the same thing, and it never got to a vote in the Senate. It died right before the session ended. In addition to this, there's a group of nonprofit organizations from around the state that are all advocates for universal healthcare. And we've come together under the Alliance for Colorado Healthcare umbrella so that we're working together. So after the thing didn't clear last year when we thought it was going, that bill, we decided that we would form this Alliance for Colorado Healthcare, which is not an actual legal entity. It's just a name that we're working under. And we're working very closely with the bill sponsors in both the House and the Senate. And we hired a lobbyist to make sure the bill has the best possible chance of passing. And we have heard from the governor's staff that if the bill passes, he will sign it. So there's a couple things you can do. You can donate to the Colorado Healthcare Coalition. We are a 501c3 nonprofit corporation, so that may enable you to take a tax deduction for your donation. You can also donate to other nonprofit advocates organizations for universal healthcare. And of course, ultimately, if this goes to the voters, my estimate is we're going to have to raise somewhere between $10 and $15 million in order to offset the things that the special interests are going to do. The other thing is you can get involved. So there's the website for our organization again. The other thing that I'd like to say is universal healthcare is not just being held up by Republicans. There's big problems with Democrats. If you think about it, the president of the United States, a Democrat, does not support universal healthcare. Neither of our federal senators supports universal health care in any big way. I did talk to Hickenlooper about 6 or 8 months ago, and he seems to be somewhat in favor of it, but he's not making a push for it. And even, in other states, our governor ran on the first time when he was running for election. He was big on having some kind of universal system, maybe having some partnerships with other states. and I haven't seen much from him since that time. Gavin Newsom in California campaigned as the strongest universal healthcare advocate you're ever going to see. And he has done essentially nothing to get universal healthcare passed in California. So, yeah, we can blame the Republicans, but in fact, there are a lot of Democrats who are not supporting this. And so, again, part of getting involved is being an advocate, talking to people, maybe, writing your senators and saying, hey, how come you're not supporting this? This is the question we asked way back at the beginning. Our healthcare system is designed to make billions of dollars in profits for large companies. It's not designed to provide a healthcare to all who need it. And the question is this what we want? I want to play one more video for you. This is one that we put together at the Colorado Healthcare Coalition. So let me see if I can get this started.
I'd like to ask you a question. Can you imagine an efficient, equitable, and comprehensive universal healthcare system in Colorado?
Can you imagine all Colorado residents being covered?
Can you imagine receiving comprehensive, medically appropriate care, including dental, vision, hearing, and mental health care?
Can you imagine receiving home care and long-term care?
Can you imagine being free to make healthcare decisions with your healthcare providers?
Can you imagine being free to choose your qualified healthcare providers?
Can you imagine funding this system by paying premiums based on your ability to pay?
Can you imagine being free from deductibles, co-pays, and medical debt?
Can you imagine benefiting from fair drug and hospital prices and having healthcare providers receive fair payment?
Can you imagine being free from middlemen with the incentives and power to limit benefits or impose other barriers to your care?
Can you imagine gaining this kind of freedom from simply changing the messed up way we pay for healthcare? I can.
I can.
So I think at this point I'll stop sharing and we can entertain questions. Karen?
Yeah, the first question in our chat is Emma said, when you're talking about covering all residents of Colorado in a single barrier system, does that include everyone regardless of immigration status?
Yes, absolutely. That there's in the bill that's running through the legislature, there's 10 must-have points that when this analysis is done, they have to take those into consideration. And that's one of them, that it covers all residents of Colorado.
Yeah. And I'd like to add that if you go to another country and you need that has such a system, you go to their medical facilities, they don't say, are you a resident here? Do you, they take you in and deal with it. So a healthier population is the best population. The next question was one I put in, that California, Oregon, and Washington are close. California got all the way up to passing it, and it died at the very last minute. So, and Oregon and Washington are close. They can pass a plan through the legislature, but Colorado needs to put it to the vote of the people. Is that true, Guinn?
That's right. Because of the Tabor law, basically anything that increases government revenues has to be voted on by the people. So that's why we had that Amendment 69 back in 2016 had to pass a vote of the people. But like you say, in some of these other places, if the legislature passes a system, it goes into effect there.
Yeah. Do you think the majority of Colorado residents support the idea? Have you seen any recent polling?
So in general, you find that about 85% of Democrats support a single payer healthcare system, or let's just say everybody can get the healthcare they need regardless of how much money they have. But what's interesting is a slight majority of Republicans also say that everybody should be able to get the healthcare that they need. So I think the support is definitely there. The thing we're going to run into if we put something in front of the voters is, again, these special interests are going to spend hundreds of millions of dollars not hundreds of millions, tens of millions of dollars. I don't think you can spend hundreds of millions in one state in that short a period of time. But we're going to have to offset that. Show people when Amendment 69 was up. My daughter, who was going to CU at the time in Boulder, called me up and said, "Dad, how come I never see any pro Amendment 69 ads on TV? All I see are these anti ones." Well, it was because we simply didn't have the money to counteract that.
Yeah. Huh. Virginia's asking, would single payer system eliminate collection costs and bad debt write-offs for hospitals? What changes occur for those lacking coverage?
So under single payer, nobody lacks coverage. There's, everybody's just covered. Basically, you sign up, you get a card when you go to the hospital or a doctor or whatever, you give them a card. And then the provider is guaranteed, just like with Medicare now, that they're going to get paid, assuming that they're not doing something, the provider's not doing something shady where they're being investigated because they're trying to rip off the system. But in most cases, the provider will get paid because that's what the system does. And of course, you as a patient don't have to pay anything. There may be some small co-payments for things like drugs and so on. There's some of that going on even in Canada, but it's things that people can afford, and it's typically set up to where if you can't afford it, you don't have to pay it. So medical debt goes away. All those bankruptcies associated with bad debt for medical care go away. So it's a system where everybody's concentrating on getting you better, treating whatever it is that's wrong with you and not worrying about, whether you can afford to pay for it.
Mm-hmm. Okay, Tara asks, what about the language used? You seem to be speaking as if single payer system is the same as universal health care. Is this true?
Okay, that's a good question. Universal health care, again, is a system where everybody gets the health care they need, excuse me, regardless of whether how much money they have, okay? Single payer is one way of implementing universal health care. Government-run system is another way of implementing universal health care. The system that they have in France or Germany is yet another way of implementing that. So universal health care is everybody gets what they need. Single payer is a way to make sure that happens.
Mm-hmm. So Brandy says, would Colorado residents still need to carry insurance to cover health care received from out of state? And I think the bill that we're working to pass now, the study of the public health care, or the public health School of Public Health in Colorado, is going to answer that, right?
Well, that's one of the things that has to be decided. And that's one of the reasons we want this study, is so that we can see what's involved there. But the way these normally work is, yes, if you were temporarily out of Colorado and you needed medical care, then the state of Colorado would pay for that. If you move out of Colorado, then of course you're no longer a Colorado resident, and so it wouldn't be paid for. But yes, there are things like that. And I mean, certainly the Colorado system, if we had something called Colorado Care, could negotiate prices for other places. So for instance, if you have cancer and the best place for your cancer to be treated is at MD Anderson in Houston, if we had negotiated something with them, then that could be covered and the state would pay for it. And I think actually in Canada, I believe that if you have something that there's not somebody in Canada that can really treat it, they will pay for you to go to the US or some other country and have that taken care of. So yeah, that's one of the things that the study needs to look at. But the intention would be that you would not need insurance to go out of the state. You might still want insurance to cover costs if you're going out of the country, because typically what they're going to do in another country, if you have something, is they're going to get you back into good enough shape that you can fly home. So, there may be medical ambulance costs or things like that. And we already have that. I mean, typically when you travel out of the country, you want to look at buying travel health insurance for that trip.
Okay. Virginia asks, what impedes support by the president and our federal senators?
That's a good question. I think it's quite clear that President Biden is very much tied up in Obamacare. That is, he was involved when that was being developed. And certainly, you know, from the point of view of electability and that sort of thing, he wants to play that up, that Obamacare was this great thing that we passed. It was obviously better than nothing, but it didn't cover everybody. So I think that he just, it seems to me, this is my opinion, okay, there's no facts here. This is my opinion. He's just invested in Obamacare. And so he doesn't really consider that we need to do anything better than that. With Bennett and Hickenlooper, I don't know. Maybe they look at it as a negative from a campaign point of view because they know that if they support it, Republicans are going to attack them for trying to get socialized medicine. I don't know. I mean, you'd have to ask them what's going on. Again, I had that conversation with Hickenlooper for about 3 or 4 minutes over at Carver's when he was here. And he said he felt like there were 10 to 15 Republican senators who would vote for a Medicare for all bill, except that they would lose their seat if they did. So I suspect it's a political calculation that they're making as to, you know, what puts them in a better position to get things done, both to get reelected and to get things done for the people of Colorado.
And I just skipped to the one Tara just put in. At one point, Bennett was in favor of a single payer system. Well, he had his own. He called it Medicare X. You want to talk about that?
Well, that wasn't really a single payer system. It was kind of an extension of Medicare. And you know, all these things that we do to tweak the system, it's such a disastrous, broken system that tweaking it doesn't really do very much. So again, it's politics. It's what do they think is best in their particular situation. You know, why did Gavin Newsom, who again campaigned as the strongest proponent of single payer you're ever going to see, why did he suddenly back off? And there's various people that have come up with reasons why he might have done that. And of course, it actually did pass the California legislature twice when Schwarzenegger was the governor, and he vetoed it both times.
Brandy adds that both senators responded to letters when he wrote to them about his $125,000 medical bill. Do you want to unmute Brandy and say what they said?
Yeah, actually, they were pretty compassionate about the situation. My husband was diagnosed with a chronic condition 3 years ago and had an emergency life flight to Salt Lake City. And it took them 3 years to get us our bill, so we can't appeal to the insurance. And so he wrote to Bennett, Hickenlooper, and Boebert. We have not heard back from Boebert's office, which probably doesn't surprise anybody on this call. But yeah, Bennett's office actually contacted a lawyer and discussed this case with a lawyer, which we can't, do without paying a lawyer, to discuss options. And Hickenlooper's office got him connected with the, Guinn would know the name of this board better than I do. It's the Colorado Insurance. It's the board that oversees the insurance companies. And so they reached out proactively to my husband to discuss this bill and what this medical bill, to see what steps that we could take and what our rights are, and just gave us recommended advice. So, both of them got personalized attention on this that we would not have been able to do ourselves. Now, has it gotten us a resolution and gotten us out of the bill? No. But at least they paid attention.
Yeah, that's good. And that's fairly typical of their offices. If you run into a big problem, typically they will try to help you out. The question again is, are they supportive of the idea of doing away with this kind of thing to where people don't run into massive medical bills?
Yeah, can you imagine? Being life flighted because you needed it and it's paid. Dr. Grossman says, would cosmetic surgery be covered under single payer? I think that depends on why you need it.
Yeah, I mean, basically what we say is that if it's medically necessary, then it's covered by the single payer system. So for instance, if you wanted to have a facelift, you didn't need it medically, it wasn't impacting your life, but you just wanted to have it, you'd have to pay for that. The single payer system is not going to pay for that. But anything that's medically necessary, it would be covered. The one thing that there's a lot of debate about is long-term care. That also puts a lot of people into bankruptcy because it's very expensive. And so we don't know whether that could be covered under a state single payer system or not. The School of Public Health says almost certainly not, but it may be that it could be partially covered. So for instance, depending on your wealth, your income, right now you can get long-term care under Medicaid, which is the federal health, well, it's actually a federal state partnership for people with very low income. But once your income gets up to not all that high, that cuts off. So, one of the things that we're trying to look at here is what can we do about that? Because, long-term care is a big problem for people and it's expensive, and how do we manage that? So again, if it's medically necessary, that would be covered.
All right. I'll back up a minute before I get to Kirby's question. Jan Phillips says, would you consider giving this presentation to the Chamber of Commerce or conservative groups and field their questions? And it's great to plant seeds while hopefully this bill gets passed in another year it'll take to do the study. So have you got any farther with the Chamber of Commerce?
No, I've talked to Jack Llewellyn about this, and it's we were talking maybe second quarter, and I haven't heard anything back. In fact, I have a note to myself to call him back, see what's going on. But I definitely would like to make the presentation to the Chamber of Commerce, and we are absolutely. I mean, one of the things that the Colorado Healthcare Coalition is doing here is trying to reach out to different groups. Like we did a presentation for Kiwanis. We've got one scheduled for the Durango Evening Rotary. These are going to be much shorter than this one. But we definitely want to talk to as many groups as we possibly can around the area. And I've sort of made a commitment to the Alliance that we'll cover the Western Slope. So, we may at some point actually start doing presentations in places like Montrose and Grand Junction. And we're working with the Alliance to get these kinds of presentations done on the Front Range.
Well, with Zoom, it's definitely possible to do that on all the Western Slope counties. It's great because you're telling the same information even if you were here in person. So
Yep.
On the top of the chat, I put in a couple of the Earth Day announcements, and then the Tuesday, April 23rd at 6 p.m. at the Strater is when Guinn will be at the evening Rotary Club. So that's up at the top of the chat. And then, Tara asks, I'm curious, how many folks on this call have long-term care insurance? Not me.
Yeah, I'm going to guess not many. Shauna and I actually investigated that. If you're going to buy long-term health insurance, you need to buy it when you're young. Because once you're my age, and Shauna's age, and if you've got any pre-existing conditions, you can pretty much forget about it. But we said there's no way we can possibly afford that given our age and pre-existing conditions. It was crazy expensive.
So Kirby says, are there opportunities for listeners to either share their healthcare stories or getting more involved in an ongoing way to support HB 24-1075? And I put the link to the actual bill about midway up there in the chat, so you can find that link.
Yeah, one of the things I would say is we have about 650 people on our coalition mailing list. If you go to our website you can sign up for that list. We don't send out a lot of, once a month at the most, typically. And we just sent out an email asking people to contact the members of the House Appropriations Committee and gave them, an idea of what we want to talk about. We're not trying to talk them into a single payer system. We're just trying to talk them into financing this bill to do the analysis so that we can come back and decide what we want to do after that. Obviously, what we'd hope is that the analysis would come back and say, yes, you can do this. Here's the right ways to do it. We would then try to go back to the legislature and get a referred measure sent to the voters to establish this system. So we're still, a couple years away from that point, and that's the long-term goal. Again, universal health care in the state of Colorado.
I'll want to point out that it did pass appropriations last year easily. So it's just frustrating that it came to the very end, and what it was missing was a third reading before they could do the vote, and there was no time left in the session. But everything was all ready to go, and now it's sitting in appropriations. So we need to call those people.
And we understand that the Appropriations Committee has a very difficult job here. The estimate is there's about $25 million available, and the backlog of bills is 280 million or something. So, they can only fund about 10% of the bills that have been introduced. So it puts them in a difficult position. But my contention is that there's not another bill out there that has the potential to do as much good and save as much money as this particular bill. And so $400,000, yeah, it's a fair chunk of change, but when you start talking about saving billions of dollars every year, that kind of doesn't sound like so much.
Yep. So the other part about sharing healthcare stories, again, our website you can contact us to do that, right, Guinn?
Yeah, absolutely. And stories are always powerful. That's why I showed that video about the prior authorizations, because when you can see somebody whose father died or somebody who's gone blind because of what's going on, that has impact on people. And so we're always looking for those kinds of stories, and you can send to our info at cohccoalition.org stories, and we would be more than happy to work with you to get those stories out there. Again, we can do some videos and that sort of thing. And so we'd like to hear from you very much, particularly if you're willing to share your story with the public.
That's great. So and we're going to have some presentations at the library coming up. Dates aren't set yet, but we're working on that. So we advertise in the Telegraph and their calendar. We advertise it in the Durango Herald and their calendar. I think they printed today's thing. Mainly we need word of mouth so people can tell everybody they know that this is a great effort to get involved with. And, it's good stuff. So thank you so much, Guinn, for giving us this presentation today.
Oh, you're definitely welcome. I spend a lot of my time on this, and I think it's really important, not just for us, but for our kids and our grandkids and so on, that'll have to go through even worse as the prices keep going up.
Yeah, I think those of us, I'm on the board with Guinn, and so is Philip. Hi, Philip. So, and Jan Phillips, you're also working with the League of Women Voters Healthcare Committee to do work locally on the issues here in La Plata County. I thought she might weigh in there, but that's well, thank you all for participating, and we'll see you next month. We're going to have a lawyer from the Earth Law Center next month. You'll see more at the DEMS website.
And the recording of this will be available probably tomorrow. We'll send it out to everybody that registered for this, and maybe send it out to some of the others. Feel free to distribute the link, and the more people we can get to understand what's going on, the better it'll be.